And now we've got Rachel Combe, who is a physiotherapist and a Pilates expert, I think. I'm hoping that's the case. Rachel, thank you so much for calling in and saying hi.
No problem, Peter. Thanks for having me.
Are you an expert?
I think that's a big call, but I've done Pilates for about 25 years now and done a lot of qualifications over that time. I think that probably helps a huge amount, obviously coupled with my physiotherapy background, which I've been a physio for almost 24 years now. And I have a classical ballet background as well. So it's sort of marrying everything up that helps that expertise as well.
What's the difference then when you talk Pilates and then you can do all those other skills? So does Pilates stand alone when people start to talk about, I'm going to a Pilates class? Is there anything at all that makes Pilates stand away from other disciplines?
Absolutely. Pilates is a real focus on core stability, but it's so much more than that. It's a focus on flexibility. We do a lot of work on breathing as well, and it's one of those kind of things that everyone can do and access at any age, any ability level, etc., from elite sports people all the way through to more of the elderly population as well. And I guess in terms of what I bring to the table with my physiotherapy is my understanding, a deeper understanding, I guess, of anatomy and injury management and rehabilitation, and marrying that plus the traditional method of Pilates works really, really nicely. I think historically, physios always prescribe exercises, and it's one of those things that people often lament. I went to the physio and they gave me all these exercises and they're all a bit boring.
Oh, okay.
And I think that Pilates brings to life a lot of the exercises that we've tried to, over the years, prescribe to patients, and in a more meaningful, sustainable way. So patients can come along to Pilates classes or rehabilitation sessions as well, and it becomes something that they actually really enjoy rather than begrudgingly do these exercises.
Well, I'm going to become Bill or Bob Basic. I'm going to ask you the Bill or Bob Basic questions. Do you have to have something wrong with your body to go to Pilates?
Absolutely not, no. So I think historically a lot of people have actually done Pilates as a preventative form of exercise in terms of toning and strengthening the body in terms of flexibility as well. So no, not at all. You don't have to have an injury.
Do you take a mat to a class?
Well, it's an interesting question. There's so many different forms of doing Pilates now. So yes, mat classes are one form of Pilates, and probably my most passionate area of Pilates, being a dancer, it has the most access to creativity and choreography. Having said that, a lot of Pilates is conducted on spring-based equipment, which most people probably would have seen, although I never assume anything now. Some people walk into a Pilates studio and say it looks a bit like a torture chamber. But no, so the mat exercises are the most accessible, so obviously you don't need expensive equipment, but the spring-based equipment is very effective, probably more effective in terms of resistance training and also rehabilitation as well.
But is it the sort of thing, Rachel, that you can do once and then step away and say, that's not going to work for me? Or, yes, it does work for me, but I can't do anything consistently. Do you need people, or those people that are going to be giving Pilates a try, to say, look, we need to give you a 3 or 4 weeks or a month or 6 weeks or whatever?
Yeah, look, I think it's interesting, the efficacy of Pilates. So I think probably even in a class or two, people start to feel some benefit, whether it's just at a superficial level, accessing abdominal muscles that maybe they haven't before, and they carry that through that neurology through to their everyday life. In terms of long-standing benefits, I see in a clinic probably that improvement start within the 1 month phase as well. And it's one of those things that's a slow burner. So if you continue on, it actually gets better and better. And often it's our clients that come back after a protracted period away from Pilates where they actually realise the true benefit. I actually stopped Pilates and, actually all my aches and pains came back. And so sometimes that's when you actually realise the benefits as opposed to when you're actually doing it as well.
Well, why did you become attracted to Pilates?
Well, probably my very first foray into Pilates or understanding of Pilates was actually when I was doing classical ballet. So I did 18 years of classical ballet growing up.
So classical ballet, I'm trying to visualise that you've got music to enhance your presentation.
Yes.
You'll be stretching your body in all different directions,
That's
so you'll
right.
have to have the supple muscles, etc.,
That's
etc.
right. Yes, yes.
So you're doing all that, but you felt you needed more.
Well, I actually didn't do Pilates when I was doing classical ballet, but I learnt to know about it through a couple of my friends who had quite nasty injuries injuries in ballet. And back probably 30 odd years ago, it wasn't very accessible, in Adelaide at least. And there was only one lady called Nicole Vass who was very influential in my first influence of Pilates. And she was a physiotherapist that had married together her Pilates background at the Centre of Performing Arts, which is now doesn't exist anymore. But a couple of my friends went to Nicole Vass and did extensive Pilates rehab, and much to my horror, they came back better than ever. But no, so I guess that was my first sort of influence with Pilates. And then as I went through physiotherapy, my final year, I spent quite a lot of time in my elective focusing on Pilates, initially with dancers, but also how we could present that to the greater population as well.
All right, let's talk specifically about Pilates then. If you were, and I'm asking you to try and explain this, how would you describe to the lay person exactly what happens when you walk into a Pilates class?
Oh, that's a good one. Well, probably the first thing that you do is you go to the mat, and some classes start in standing and some classes start lying down on the floor. The first part of the class is actually centering and breathing and activating your core muscles in a very gentle way. So we'll actually focus on engaging the abdominals, also engaging the pelvic floor as well, which has been known to help with pelvic stability. A focus on deep breathing and aligning the body so it's prepared to move in the best anatomical way as well.
So are you going to each individual person as the Pilates, the session starts to unfold, you're checking each person to make sure that they're exercising correctly, their posture's the way it should be, etc.?
Yeah, exactly. And I think that's what differentiates Pilates maybe from a lot of gym exercise classes, which are sort of packed to the rafters of 50 plus people. Pilates mat classes, well, certainly we do, we try and limit our classes to about 10 people. And that allows us to actually get that individualised correction and hands-on correction, which is so vital to get the accuracy of the method as well.
Do you have acupuncture as something that would happen regularly?
No, that's not really part of it. I mean, given that we're all physios, if someone did come in and present with an injury, we would actually suggest that they have some physiotherapy treatment, and physiotherapists employ the method of Western dry needling. We don't use acupuncture per se, although a few people do.
Yes.
But treatment is really helpful to facilitate better movement quality.
Now, I've got the tough ones coming up here. You ready for them, Rachel? How do you sort out someone's spiritual well-being?
That's a good question. It's interesting. I don't know what the woman that talked about yoga last week, I think yoga does have a spirituality to it. I think a lot of people do get confused with Pilates and think that there is a spirituality component.
Is there?
No. Joseph Pilates was a German man that came up with this method of exercises called controlology. It's hard to say.
You did well.
And he wasn't religious as far as I'm aware. I think probably people pick up on the sort of spiritual aspect of it because there is a strong meditative benefit from Pilates, probably because we are focusing so much on Pilates, on breathing, but also, especially our classes we do with no music. So it's a very nice, mindful hour that you spend in a Pilates mat class.
Why don't you have music?
That's, for me, it's a real strong point and personal preference. I think music is distracting, and if you're really concentrating on all of the cues that we give throughout the class, the music kind of gets in the way. I personally also find music distracting being a singer. I tend to just kind of start listening to what the music is and not concentrating on what I'm doing. But more importantly, I find that the silence is what people often comment on. It's really nice to just have an hour of no oral input apart from what you're saying. That actually adds to the relaxation.
And you mentioned, Rachel, about size of classes. You said 10. Is that pretty much the maximum?
Well, I think that's our sort of opinion. Some people would have even less than that as well, and it is a bit of a sort of personal preference. I think from my level of expertise, I feel very comfortable with 10 to be able to give a fairly individualised approach, even in a class situation. I think any more than that, and it starts getting a bit unwieldy, and you lose that individualised care.
Okay. I'll stay with you. I'd like to continue this discussion. Rachel Combe, who is a physiotherapist and a Pilates expert. And she's also, you didn't say you were a belly dancer, did you? You're a dancer.
Ballet dancer.
And all sorts of things. And also the maker of a pretty damn good birthday cake for celebrations for your husband tomorrow. Tell us about Paul.
Well, I can't even take the credit for the birthday cake. I'll give a lovely shout out to Kalimnos Pastries, who I picked up their beautiful cream katifi this morning.
Their what?
Cream katifi. It's that beautiful shredded wheat and honey and
stop it, I'm hungry.
baked custard. It's beautiful, beautiful. They do a really good job. So no, I haven't been baking a cake, but yeah, Paul's turning 50, and it's going to be a lovely family affair at our house tomorrow afternoon.
All right, don't go away. I'll continue our discussion on 1395 5AA on Saturday afternoon with Peter Walsh and Rachel Combe in just a moment.
This is Peter Walsh, Saturday Sport, Adelaide's 5AA.
Now, all these people outside the building doing Pilates, just settle down. Settle down. Rachel Combe can go out and give you the correct directions. Rachel, as we continue our fascinating discussion, sometimes there might be a feeling of embarrassment for somebody who has to go and, in front of other people, sit on a mat, and you're looking around and you're thinking, I don't know whether I'm doing this exercise correct. I'm a little bit wary of what's happening. How do you make those people, if they're going to a class that you're involved in, how do you settle their nerves down and make them feel as if you're going to be able to help them?
Yeah, look, I think that's a valid point, and I think a lot of people think it's going to be lycra leotards and very vigorous as well, which it can be, but certainly not in our studio. And so part of it's the lead up to getting them into a class, so spending a couple of half an hour sessions doing some one-on-ones so that they have...
So what do you do with your one-on-ones?
We just teach them the Pilates basics and go through some of the more foundation exercises, so they've got a little bit of a vernacular when they actually come into the class, and they might have heard a few names like the bridging exercise or the curl up, etc. But I often sort of say to clients, funnily enough, no one's looking at you. Everyone's so deep in their own thought, and often people do close their eyes, so they're actually not looking at you. There's not any sense of copying someone else. Everyone's quite deep in thought and deep in their own world. So, I think it's important to create such a warm environment and a nurturing environment, which certainly at our studio we've had that comment many times, that it's a very inclusive environment to be in.
How long would a session take?
We do 1 hour classes with our mat classes, and our equipment classes are about the same as well.
So the equipment is something like gym equipment, anything like that?
Not at all, no. It's, as I said before, it kind of does look a little bit like a torture chamber, but I don't want to put listeners off in terms of that. No, it's actually spring-based equipment. So in a gym, the resistance is created by actual weights, and some people have had experience with resistance using TheraBands or free weights, etc. The resistance on the Pilates equipment is through springs, and so springs of different tensile strength and different length as well. And so springs can actually be used on the equipment, which I think is quite a differentiating factor of the equipment, not just for strength training and load, but actually can be used to assist movement as well. So if someone's come in and hurt their back and they can't do a particular movement, we can actually emulate that movement, but with a little bit of spring assistance, and that movement is then achieved with a little bit more confidence, and then we can wind back that assistance as the movement becomes more confident.
So the one person, in this case yourself, you're full on then. If you've got a class going and you're looking and you're taking a question from someone who might not feel all that smart, there might be a bit of a twinge in the back, you've got to be full on to know what to do.
Absolutely, and I think, again, certainly for me, that's my physio background that will modify that, but there's some great Pilates instructors out there as well, and they've got a really good understanding of injuries. And I think that's the other really great thing about Pilates is it's extremely modifiable. So I could have a class of very mixed ability levels. We try to stream them as much as possible, but someone often does come in and say, look, I did some gardening over the weekend and my back's really sore. Can you just keep an eye on me? And often there'll be an exercise where I think that's going to load up your back a bit too much, and I'll just give them a little regression on the spot.
Okay. Is it weight reducing as well? Can you walk in and say, excuse me, the Christmas period is coming up, and when I get on the scales, they're going to say, get off. I need to be able to watch what I'm eating and or drinking. Help me.
In a nutshell, no.
No.
I say to people, Pilates will help pretty much every aspect of fitness, from flexibility to strength, as I said, the breathing control, balance, all of those things. But it really, unless you're doing it at extremely vigorous level where you're getting your heart rate up, it's not going to help per se with weight loss. What it will do, though, is increase your strength strength and postural awareness, so that someone that has a lot of weight, carrying a lot of weight, if they sit with poor posture, they kind of look bigger.
Yes.
And if they're sitting tall with that elongation through their spine and they're activating their abdominals, at least the muscles are actually more supportive and are giving that appearance of being a bit slimmer. But no, the only way you can really lose weight through exercise is getting your heart rate up as well.
So people then who are a little conscious of carrying too much weight, that shouldn't prevent them from going to a class?
No, not at all. In fact, as I said, I think it's a really inclusive way of bringing people in that maybe have been intimidated by normal gym classes or exercise classes where they don't have that aerobic capacity. It's a really nice way of introducing them to movement again. And particularly a lot of overweight people do carry a lot of injuries because they are carrying extra load. And again, it's a very non-impactful or low-impactful way of introducing exercise again. And then as their pain starts to dissipate, they can start to get their heart rate up and do more cardio exercise.
Yeah, what it does do too is it means that there's so many options. I'm talking about someone who lives in the hills just out of Adelaide, and we're talking a couple of weeks ago about the Indian lass who was talking about yoga, and next week or the week after we're talking meditation. So it's pretty much a matter of what suits the particular person.
Absolutely. And I think at a much broader level, even beyond Pilates, being a physiotherapist and being so passionate about physical activity, we have a real epidemic in the world, Western society, where no one's moving enough. And I think we've got a massive problem with the health dollar and spending so much money on obesity and inactivity. So I think when people say what's the best form of exercise, it doesn't really matter. You've just got to move and get on with it.